to order.
Fantastic. All right. This is Tasha, co-chair of the Justice Project Oversight and Planning Committee. I am officially calling this meeting to order. Today's date is April 7th.
Marty, you're muted, so we can't hear. Marty or Holly, if people are talking, you're okay, you know you're muted.
Okay, we'll try. I just turned my audio back on. Maybe I need to move up closer.
The other thing is you turn your audio on and I can like.
Okay. Okay, let's try this.
Whoa, whoa.
That doesn't work.
Your audio sounds right.
Okay, I just turned it back on. Okay. Okay. All right. I'm sorry, folks at home, we're going to try and all project here in this room so that everybody can hear. And maybe if I move this over and sit.
I think you'll be fine. So here's
Okay.
what we'll do. When the presenters speak, it should be pretty easy to hear you. If you just stand up, maybe even half the podium. When people from the audience speak, if you have a question, I'll repeat back in a really big voice. And I think we'll all be heard, yeah? Okay. So we did our land acknowledgement, we called to order. People who are dialing in, can you hear me when I'm speaking now? Give it a sec by please raising your hands on the screen.
I saw Mary Lou's head. Yep.
Yeah.
Thank you, Mary Lou.
Take that, yeah. You're good. Okay, we've got here on the agenda, can we flip the screens, please?
Yeah.
We are, there's this whole other body that is happening, the Finance and Facility Advisory Board, also called the FAB. And we're going to hear a little bit about what they do, so we're all informed about that. Then we're going to hear from STB, so we get this week. How long have we been waiting for this, Jane? Right, since I think our first meeting, we're so excited to have you here. Here, to get started on this process, and then we'll continue our work with Julia with all of the performance measurement stuff we've been working on. Okay, so that's the heart of our meeting, and then at the very end we'll do a little bit on our annual report. So hopefully you all read your packet, right? So if you have any comments, it'd be great to hear them. All right, you got the logistics, right? People who are online, just raise your hand this time with the hand button is going to be easiest for me, please. Okay, here we go. So 2025 action plan. Marty, take it away.
Okay, I'm going to just say really quickly that where we are right now is here. This is today. Holly just went through this agenda. We are on track with our action plan, and it's going great. In May, we'll talk at the very end about what we're going to cover in May, but that's here. All of you got a full action plan in the packet, and I'll try and remember to do that at least every other month, if not every month, so that you have the full scope of what we're doing. And the part that I really enjoy looking at is this right here, because these are our roles, as it says right at the top of your action plan. These are our roles, and we are doing them. So that's gratifying there to see. And then we are going to just skip on over here to our Finance Advisory Board folks.
Hey, I know you're gonna hate this, and I'm gonna have to get up front. So that people, yes, are you willing? Okay, because that is the only way they seem to move
Right.
this.
When we speak, or all of us right now?
As whichever it works. It's like your last presentation is.
I'm gonna be fast, so.
All right.
When you say
Okay.
front, do you mean like where Marty is, or do you mean
You
like
can,
front? All right.
you want to lean on here? You can. And then your face will be in the screen and I'll get out of the way.
I don't know how
We don't have
good that
glass.
is.
Yeah, okay, Barry.
Good afternoon, everybody.
So your neck is. Okay, there we go.
Hey, good afternoon, everyone. Welcome to our JPOP meeting. The FAB, which stands for Facilities and Finance Advisory Board, was created at the same time by ordinance as the JPOP was. So the JPOP and the FAB were designed to have some oversight roles in the whole process. The FAB is really looking at the financial side of things, and now we're really interested in this capacity analysis that's going to be done. But kind of the history of the FAB is that we felt we needed kind of two lanes for oversight, one being the JPOP work and how we integrate behavioral health services into our thinking and into our project. And then the FAB, which is really nuts and bolts in the construction part of the project. So I'm going to turn it over to the next speaker, Jack Lovinier. And I'm going to be very
Thank you, Barry.
careful not kill myself.
We've been allocated time, so I'm going to set a timer because I would otherwise probably overrun it. My name is Jack Lovinier. Thanks for having us here. So sorry about all the acronyms, FAB, JPOPs, IPRTF. We don't call it IPRTF, but there's a lot of acronyms. And FAB, I think we just like it because it, fabulous, fab, whatever. But I think the first thing I'd want to say, I'm speaking for about 4 or 5 minutes on the history of how we got here. Oh, so I'm on camera for them. All right. Hi, everybody. Caleb, Stephen, whoever. All right, Maya.
That's good.
Okay. One thing I would want to say, I guess it's probably helpful to know that some of us have been involved in this for literally decades, but certainly for the last 8, 9 years, talking about this particular process. So when the third opportunity for voters to approve financing some kind of criminal justice improvement came about, there was discussion about how do we ensure, I'm going to say, fidelity to the community that the goals are achieved. And I think some of those goals included diverting where appropriate, but making sure people are secure when the community is not safe. Now, there isn't always agreement on what those metrics are, but those principles seem to have, I won't quite say universal agreement. Most people agree, why lock people up if they're not a danger? And why would we not lock up people that need to be locked up because the community or that individual is not safe? So the evolution of what happens in jails, particularly as it relates to what we call behavioral health, knowing how many people there are impacted by mental health, behavioral health, substance use, which comes under behavioral health, was part of the landscape we were looking at. 2 committees became part of the ordinance that were passed. One was this committee. I want to say you guys. I guess I'm not part of this. So you guys, the JPOP, Justice Project. What's the O stand for? Oversight. Planning. Okay. And I know because I was involved in creating the strategic plan. There's so many acronyms. I kind of need my thing to remember what they all stand for. FAB was and JPOP was seen to appropriately fit under the Incarceration Prevention Reduction Task Force. We had historically had 3 subcommittees, and we added the index, which was for collecting data, but we had different things that came under that. It fit. The Finance Advisory Committee was seen sort of separate. My own perspective, and somebody else could have a different one, was in part, it had a twofold mission. One was to advise county government, particularly the executive's office and the county council, as to what resources are available, what made the most sense. I also think there was a responsibility to wherever possible to advocate for the original priorities, that money not just be spent where there would be a natural need to spend it, which is to actually have a jail and operate it, because they're very expensive. The problem we have in part is there's always more needs than there are resources. Like we could have quadruple the budget and still probably couldn't do everything we'd like to do. You have to have a facility, you have to meet certain standards, you have to provide health for inmates that are there, people incarcerated. But we also made a commitment to the community to where possible, put some resources into diverting. And that could be everything. And that's where I could talk for 20 minutes. But some of that diversion is very practical, like right on the practical level, like a scram bracelet. So somebody that looks for alcohol, so you don't get locked up because you're on a scram bracelet. Obviously, if you could address trauma and some other things, you might do a lot of other avoiding. We can't do everything. But I think the idea for the FAB, at least in my mind in part, is to consistently say, hey, is this money being used most effectively? And then for those members of the community that say, hey, you're not spending enough on behavioral health, how do you respond to that? Well, we have to also operate a facility. So my perspective on FAB in part is to try to mediate, balance, come up with common sense and intelligent responses to those issues. Specifically in the strategic plan, summary of implementation plan, the FAB is supposed to report annually to IPRTF and the council on the financial performance of the fund, but also other resources and funding for these projects. So it would include fund revenue, expenditures by project, resources beyond that sales and use tax. That's the ordinance that was passed. Caleb, good to see you. Additional resources needed to further meet goals, and any recommendations for updates to the implementation plan. So that's sort of what FAB does. And if you were to attend a meeting, I would say either all of the decision makers or representatives or stakeholders in the entities involved in decision making are sitting there. In that sense, it's a very valuable it's a very valuable resource. I'm one of two people that are not automatically there. Like I'm there as a person of life experience. So lived experience. Thank you. Yeah, we've gone around with those terms. So I'm the one that spent a lot of time in jail and now hasn't been in jail and can speak from that perspective. So so that's sort of one of the perspectives that I bring to that. So with that, I think Heather's going to talk about some of what FAB is actually doing to achieve those goals, like practical things and where we're at right now. Is that right? And whatever else you have on your agenda. All right.
Thanks, Jeff.
Thanks.
My name's Heather Flaherty, and I am grateful and honored that I get to serve as the co-chair of the Incarceration Prevention Reduction Task Force. And I'll stand here on my tippy toes. Okay.
Yeah, there you go.
So I think there's actually people here that could speak to a lot more of the details of what the FAB meetings have been going over, and how that experience has been. I know Kayla, you're a key contributor to that, and our new friends with STV are key to that process as well. They are open public meetings, and so I encourage anyone to listen in or attend. And as Barry and Jack said, it's really focused on the financials of how are we going to afford these plans that we've put out. If I were sitting on just the JPOP committee, a few key things that I would really want to know and understand is how do we work together and how can we be collaborating effectively. And so I made this table for the incarceration task force, but I actually think it's helpful to just repeat some of the things here too. So we have the Incarceration Prevention Reduction Task Force. The primary role is that that's a strategic advisory body that's focused on reducing incarceration through system reform. And it sets value-based priorities and can make recommendations to the county, to the county executive and the county council on diversion programs and all things system related to incarceration. Then we have JPOP, which is all of you, the Justice Project Oversight and Planning Committee, and you're serving really, as you know, as the oversight and accountability for the implementation plan, which is those 15 projects, and making sure that we adhere to the values of the community, that there's a conduit for transparency and continued collaboration and checkpoints with the community on, is this the right project? What are our blind spots? How do we make sure we're achieving equity goals or behavioral health related goals or incarceration reduction and public safety goals? And then the Finance and Facility Advisory Board is really the financial oversight and looking at the funding and evaluating the revenue and the debt and the funding options. And so they work together though. And the ordinance that established these actually mandate that they work together every 2 years, I believe, on a revised spending plan. And so there's a lot of coordination and I think key touch points to continue to make sure we're sharing accurate information with each other and complete information so we can have robust discussions. So anything that you would want to add from the last meeting? You were a big part of it. We went through the timeline of our owner's rep. I'm still learning all of the things that that means, but our owner's rep is really the it's like if you're building a house, it's our general contractor kind of that would help us with all of the different pieces to build the jail that we need to build. And you have a great timeline for how the RFQ is going to roll out for things, and you have a community engagement piece incorporated. And there's been some scenarios that have been presented already, recognizing the financial trade-offs of just the conditions that we're operating in now are very different than even the conditions of when the ballot passed in 2023. And so there will be some conversations that we need to have robustly as a community about what is important, what are some non-negotiables, and where can we make trade-offs in the short run or in the long run, or if we need to, and what are other sources. So anything other key partners want to add? Any questions? Yes. Yes, Dan.
Yeah, I think you're kind of getting to my question. Thanks, Heather, for that, and other finance folks. I think that we need to have a reality check conversation pretty early on when it comes to revenues. Canadian traffic across the border is down 900,000 people across the entire border. I don't have local numbers on it, but if you go to so I sit on the organized crime board, not the mafia. CIA started. Yeah, and I sat next to Costco at the last meeting, and a rep from Costco, and she said, I went through the parking lot and I counted like 2 Canadian plates. And if you go to Trader Joe's, you can take a field trip over there today, and you can actually find a parking spot, which you can't typically find. And so my point is that sales tax revenues, which is what we're talking about here, 2.1%, they're down. They're plummeting in Bellingham's jurisdiction. I don't know where they are in the county. We made a commitment to voters to provide for behavioral health services in a very meaningful way. So behavioral care centers, 65 beds, whatever the number is going to be. And what I don't want to do is just build a box and create a monument to the past. I want to make sure that we provide for comprehensive services, which we all talk about, and we all, I think, recognize that we need in our community. And I'm very concerned about the lack of sales tax that's being collected currently, given tariffs and the creating Canada as the 51st state or whatever it's going to be. I just think that we need a reality check on that one. So that's where I'm coming from. I'm concerned that we provide for what we told the voters that we said that we would do. That's right.
So in the interest of all of our people who are online, the comment was concern from Dan about tax revenue, sales tax revenue that'll affect the income that we have to work with for our Justice Project implementation plan. Yes, please.
Yeah, so as you were talking and explaining, I was wondering if this board could also report to the JPOP on a more consistent or like more than just like every 2 years, or
Oh, yeah.
where you're at in the time, so that we can also keep up with the concerns that are very legitimate.
Yes,
Yes.
yes, question is, can the FAB talk to JPOP more than once every 2 years and provide updates? I will speak for myself but I'm looking to partners and decisions. I think that key linkages, and by that I mean like scheduled, methodical, is that FAB meets by ordinance at least once a quarter, minimal. So is it once a quarter, there's a formal report, a formal FAB report out to JPOP. And at those quarterly meetings, it would make sense for there to be a short JPOP or long JPOP report out to FAB as well, to make sure that, and there's a lot of overlap at the tables for sure, but it's really good to just have the like, here's what is going on. And I think the chair's responsibility and the agenda designer's responsibility is posing the questions at the right level and for the right scope to make sure that the input is like coordinated and complementary to get to a greater goal. And, but yes, I think your question is really astute, and there's absolutely no way we could update or provide input on a spending plan once every 2 years if we only talk once every 2 years. So my thought and expectation was that there would be like a system developed around joint updates back and forth, so.
Excellent. So I see, Barry and Tasha.
So I think one thing we could do, in addition to what Heather just outlined, is have a standing JPOP agenda item for, there's enough of us here, I think, on the FAB that we can have a check-in at least once a month.
Yeah.
To bring up anything that's bubbling up to the surface, and then have some other mechanism for more formal report.
Great.
Yeah, Tasha?
I mean, speaking to some of these concerns, and it's been voiced at other meetings as well. I don't know if this is I'm new to committees such as this. Having like just a work day where all the committee members, like, we all just don't do our work days, we do this, and in fall when we maybe have some more stats from STV, or we have something, and we just sit down and we hash it all out in one room versus like everybody having, like, it starts with IPRTF and then the finance committee, we can all sit down and we can just have these hard conversations and we just get it all done. Like, it's not done, but we hash it all out with all the ways in one room. It's a giant workshop.
Yeah. Okay, so I'm hearing ways of creating connectivity, having regular time on the JPOP agenda for FAB people to try and make
Check in.
updates. And also Tasha's idea of maybe a joint meeting once a year or something, where we just spend some serious time together. Okay, good. So let's hear it. We're gonna keep moving. We can, yes? Okay. so
Can I
yay,
just-
FAB? No, one more thing,
One, I
please.
want to respond to Councilmember Dan Hamill's comment and let you know that that is, as Tasha mentioned, a topic coming up about what are the realities of the constraints and the variables and the things we can't control. And our plan is to start a conversation at IPRTF and then ask JPOP and FAB to answer some, within their scope, some questions to help inform the county of what are the community values, what are the other potential revenue streams or different timelines that make sense so that, you know, we build a jail, but we don't give up on this behavioral health piece. What would need to be communicated back to voters if there are significant changes from anything, right? Like, so yes, Dan, I want to affirm the concerns and tell you, I think we're going to start a process next week to formalize vetting those out.
Just respond very briefly. So the city made a commitment to invest in capital as kind of like a down payment. You made like a general contractor analogy. It's kind of the same thing that we look at when it comes to building the capital part of it, the bricks and mortar of it. And then after that, we would flip the funding to like behavioral health almost 100%. And so we want to make sure that that commitment is fulfilled. And if we recall correctly, 2015, 2017, voters rejected the jail measures, and then the last time they approved it, and it's because we have these diversion programs like READ and GRACE and ART, and we had some data to be able to talk to voters about, like, you know, we are serious about diversion programs. So I just want to make sure that we have that in our thinking. That's it.
Thank you.
Thanks.
Thank you. All right, let's hear it from FAB. Thank you. All right, so we're gonna hear from STV now. Are you ready, Adam?
Sure.
Excellent.
Let me just get your slides if I can here.
Yeah, and folks, don't hesitate. The bathrooms are through there, this door. And there's snacks if you want to get up and like grab a soda.
There we go. Perfect.
Okay, let me just try to share it for the folks at home. So, Um, okay,
There we go.
let's see if you can,
It's good.
if you can control them here, I think, right here, okay?
Perfect.
All right.
Thank you. Do a little bit of that. Okay, we're good? Okay. So yeah, thanks everybody. I'm Adam Johnson, a senior project manager with STV. We'll get to this first slide. So Ashley McLaren, she should be here doing this. She's a lot better at this than I am. She's in Hawaii right now on spring break. I'd say that she'd rather be here, but she's in a tropical paradise. So no, she'd rather be there right now. This is our core team. It's Ashley and myself, and then Russ, who lives up here in Bellingham as well. So he's our construction manager on site. A little bit about me. I've been in owner's rep role for about 7 years now, doing almost exclusively public work. That's where my passion lies. I've worked on projects from the Children and Family Justice Center down in King County in Seattle to the North Sound Behavioral Health Treatment Center project in Everett. K-12 projects throughout Snohomish and King County, fire station projects. My last big project was the Mount Vernon Library Commons project in Mount Vernon. So yeah, public projects are my passion, and that's the type of stuff that I like. So yeah, that's a little bit about me, a little bit about STV. We're 100-and-something-year-old company at this point. Started in the Northeast. We're a national firm. Started as really an architecture focused firm. A lot of major projects over there on the East Coast and New England area. Everything from the new One World Trade Center to port work. A lot of infrastructure focused work, bridges, tunnels, that type of a thing. Locally, almost exclusively transit work on the design side. So a lot of work with Sound Transit, King County Metro, WashDOT, that type of thing. And then we have a relatively new project management, construction management practice here in Western Washington. So, yeah. A little bit about, I did want to spend a little bit of time just hearing some of the talk that I hear today and just knowing sort of what everybody's focus is here. We do have a much larger team behind those three. You probably won't see most of these people, maybe a couple, but I did want to call some of these folks out here. So this is our core team here. Some of these folks here that we're bringing in that are sub-consultants to us. So we have Eric Ratz here, our Justice Operations Specialist. Has anybody heard of the Franklin County project that's got brought up a bunch? Okay, so he was the lead architect on that project in Franklin County, Ohio, Columbus, Ohio. He's our subject matter expert for the justice operations portion of the project. He was also out here in March 31st, April 1st to do the jail capacity analysis, which I'll talk a little bit more about later. And then he'll be on throughout the life of the project, mostly during the design phase to be sort of a subject matter expert as well. Like I said, we also have an architecture group within STVs. We brought some of those folks along as subject matter experts. Frank Green, nationally recognized. He's right now working on the Rikers Island project in New York. So if you know anything about that, they're shutting down Rikers Island. So he's working on one of the boroughs. I think it's the Queens, the one that they're putting in Queens. That'll be the all women's facility there. He's working on another major project in Baltimore right now as well. So he'll be a subject matter expert during the design phase. And then Nathan Howell, another nationally recognized architect in the behavioral healthcare side of things. He'll be coming out May 5th to do some initial behavioral healthcare discussions with Hannah and others, just to get some initial programming ideas, and some folks working with him to talk about like possible Medicare and Medicaid funding, as far as the operations that they're going to go into this new facility. We also, as we get more into the design, after we get the design team on, we have some folks that have specialty in trauma-informed design, medical and mental health operations. I believe she has a neuroscience background, Brenda does. Folks that understand some of the MEP stuff, and then commissioning, move management. And so we have this whole team sort of behind us that most of these people you'll never hear of or see, but they're behind the scenes. So it takes a lot of people to make a facility like this work. Really, I'm here today to talk about our progress to date, what our goals are, and STV's role in this project. So, like I said, we're the owner's representative for the county on this project. We were selected, or we signed our contract in February of this year, and we're here hopefully through closeout and move in. Our first phase 1 here takes us through August of this year. We're here to help with that communications plan, attend meetings like this for stakeholder engagement. We've been to a couple of FAB meetings. We've met with folks like Barry and Heather already, and others. A lot of outreach so far. We're trying to define the scope of this project, which I think we've done a pretty good job of. We've taken a lot of feedback from a lot of different folks. Working with Chris and Rob in the facilities department to, as well as a lot of other folks in the executive department, to define the scope and the budget for this project, given the sales tax measure and what was passed. And then what we've really been doing a heavy push over the last month and a half is to build this project team. Talking about the delivery strategy for this project. And try to get a design and contractor team on board. I'm going to pause there and just talk real quick about something sort of technical, or else the rest of my slides won't make sense. Does anybody know what I mean when I talk about progressive design build? A couple people do. Okay, yeah, it's because you've heard me talk about it. So yeah, so I'll be like super quick about it, because, and I'll give you like the really high level version. So instead of selecting a contractor based on the bid for this project, we're selecting a contractor based on qualifications. The state law lets us do that under an RCW, and we have to go through a state approved process in order to do that. So we have to take it to what's called the project review committee that's on the screen there. It's a state approved, state appointed board. We have to fill out an application to do that. There's rules for which projects are allowed to do that. We have to state approve our case, and then we have to go through the procurement process. And I'll explain that procurement process in a bit. So we select that contractor, and it's not just a contractor, it's a contractor and design team together. So instead of hiring an architect, going out to design, then taking those design documents, putting them out to bid, and then building the building, we hire one contractor who has the design team, basically as a subcontractor or partner to them. So it's just one contract with a design build entity. So they're selected based on qualifications, and there's a price factor in there too. So where are we at? As you can see, the sort of grayed out stuff here, we've done quite a bit. These little dots are a lot of our stakeholder meetings that we've had. Like I said, we were brought on in February. We had to move really fast to get that PRC application in on time. And we had our PRC meeting in March. It takes you have to do it a month in advance. So we had our PRC application approved in March. We were developing our RFQ. that just hit the street yesterday. So if you want to see the RFQ, it's on the county's purchasing portal. So you can feel free to take a look and download it. It's obviously there for the public. We also started in February the communications plan. So we hope to have that complete by, I think, the week ending May 8th, 9th. That will include how we plan to communicate with this community, committee here, this task force here, IPRTF, FAB, County Council, everybody. So that's been in the works since February. As I said, we had the jail capacity and behavioral health analysis. That work has started. So on March 31st and April 1st, we had Eric Ratz from DLZ, our sub-consultant, was here. Hannah attended those meetings. Caleb was in those meetings. Sheriff, undersheriff, both Rob and Chris from facilities on day one. And then on day two, we had the prosecuting attorney and the public defender was in those meetings. Talking about sort of present conditions. We toured both the downtown jail and the work center, and then also talked about future state and what future state operations hopefully would look like. Obviously, we didn't. I'm going to get to the end of this, and I'm not going to have a bed count number for anybody or a total cost number. So nobody left. So everybody on the call, nobody left yet. So really what came out of those meetings was a better sense of, for Eric, who's doing those jail capacity that jail capacity analysis of what's happening now, what isn't working, what is a much shorter list than what isn't, a much shorter list, and then what's desired for the future and what that model looks like. There was also a list that he gave the sheriff's office and Hannah as well of data that's needed in order to inform what that jail capacity to inform the jail capacity analysis. It's about a list of about 30 different data points, which also all need to be broken up into male and female populations as well. And I know Caleb and his team have been working on that. And have provided some of that so far and are still working on a bunch of that. So once we have all of that data, then obviously Eric is can finish that process out, and then we'll have a report and we'll start looking through that and figuring out what that looks like for the new facility. As far as the RFQ goes and bringing on that design build team, we'll receive the SOQ. So it's a little bit of a different process. So this qualifications-based process, basically we'll receive statements of qualifications from that RFQ. We'll use that to shortlist down to 3 firms. And from there, then we'll actually issue an RFP to those firms. And we'll say, okay, so the RFQ is basically show us how qualified you are to do this project. The RFP is, okay, now show us what you're going to do on this project. And we'll ask for a management plan from those folks. And we'll say, what are you going to do for us on this? And we'll ask more targeted, specific questions to this project, including a lot of the goals that everybody has for this project. We'll also hold interactive meetings, not so much interviews, they're interactive meetings. Those interactive meetings are their chance to inform their management plan and ask questions of the scoring team and other members of the project team. It also gives us a chance to see how well they work together and how well they might work with us. And that then informs their management plan. They give us a fee proposal, and hopefully we get an outstanding team. Our plan is also to have both the jail capacity and the behavioral health analysis drafts done just before we have the that design build team on board come August. So we'll have an intent to award in July. It'll take a few weeks to contract. We expect to have them on board contracted in August. By that time, we'll have those reports complete. We could then hand it to that design build team and get started right away. We have some more lots more stakeholder meetings, obviously in here. Some more IPRTF engagement here that you see. We'll likely have updates in August, and then in October. The nice thing about a progressive design build delivery process, especially when you're starting from where we're starting from on a project like this, where we know generally what we want, but we don't have a very well-defined scope, right? It's this programming phase that you see down here at the bottom. It's you have everybody, well, almost everybody at the table that you need in that early phase. So you have the contractor, you have the design team. You can pull in major subcontractors if you want at that time period too. And so everybody's at the table to make important decisions about cost, scope, schedule, and really figure out, okay, is this a 750 bed facility and how much of that is behavioral care? Is this a 400 bed facility and how much of that is behavioral care? What is operationally, how much is this going to cost? We could figure in the operational cost models while we're going through that exercise, and that'll take place during design as well. When we come out of this validation stage, this programming phase, hopefully in Q1 of next year is what we're aiming for. We'll have a bunch of different options for the county exec and the county council to go through and say, hey, given this budget, given this schedule, these are our different scope options that we can look at. These are the different operational models that we can look at. So it won't be, here you go, take it or leave it. It'll be, here's our choices and our options. And those will be provided to FAB, IPRTF, council exec. So we'll have a decision-making process to go through at that point. Also, towards the end of this year, after we get the design build team on board, obviously our community engagement is still going to be going on. It's not going to stop. It's going to continue through the rest of this project. We'll have our communications plan sort of nailed down at that point, but doesn't mean it's not going to change, or we're not going to adapt as we go through. We'll be having a lot of subcontractor outreach during that time. Our goal is to keep as many of the dollars local as we can, and encourage local participation by local subs and consultants as well. We're also probably going to have a local a goal for local hires, local priority hires, for local tradespeople as well. And so that's really what we're looking at for the rest of the year. Sure, there's questions.
Right, go ahead. Floor is open.
Can they hear me? I work for like a social service agency, so when we talk about stakeholders, we involve like the youth and young adults that we serve when it comes to receiving feedback on how to improve our services. So I was wondering if stakeholders, if inmates are considered stakeholders in this process when it comes to like the design. Are there like work groups in place where inmates can be involved in developing design, or do they have opportunities to provide any feedback regarding jail facility design before the designing phase happens and all?
So when, if you could
Yeah.
repeat the question.
So the question was, will inmates have any opportunity to provide feedback on the design either before or during the design phase? Caleb, I think there's some survey that's happening now or in process of happening now.
Yeah, there are actually two phases of it. Number one will be a survey that will go out to the incarcerated population via tablet. So if anybody who has access to a tablet can respond to the survey, they'll be able to provide input. That will then influence a series of at least 3 focus groups where we'll have guided conversation in the housing units to get feedback directly from the people who are incarcerated.
Yeah.
And those should be within the next couple of weeks.
Okay, so for the people online, there is a survey that's going out to inmates currently through the tablets, and then that'll inform more of a focus group in person in the housing units.
Might add that back.
Yeah.
Okay. Okay. I have that back. Yes.
Focus groups inform the survey.
Focus groups inform the survey.
We're so happy, this is a good time to say that, the state internal review board approved our exemption from review, so we are good to go, and we have funding, so we are good to go. And like Caleb said, we're gonna go crank out those focus groups and survey and report back. And Franny, we worked together here on the questions a little bit before you joined the committee, and we will bring back what we learned to this committee. So, yes, we're on the same thing.
Mhm.
Go ahead.
I have a question related to data. You mentioned, that the sheriff's office had, there was some 30 parameters essentially that would help decision making. Where can we find those parameters and like how, what is the process to answer those parameters? Like, I'm asking because, the commission also wants to do some, data analysis on recent incarceration data that we sent. And wondering if we have the same questions and if we could work together in some way. Can you repeat?
Yeah, the question was about what is the data being requested to inform the jail capacity analysis?
Very different data points.
Yeah. I can't my head, but it's things like average length of stay, how many people are there, get released within 24 hours versus 48 hours versus 72 hours. Yeah.
I think the question is, can you see a copy of us, right?
Yeah.
So is that possible that we could see a copy of what those?
Yeah, I don't think that that's unrealistic. I took a picture of a slide and requested the information based on that. Yeah, it's a handful of information based on how many, what, average length of stay is, peak factor, lowest factor, broken down by month, broken down by year, broken down by gender, broken by, average length of stay, a number of different factors revolving around that, but it's a handful of questions on this.
I'm just making a way for them sort of experience like what do you have already and what do you have already.
Sorry.
No, I think the core question is, can we get a copy of it?
Yes.
And then maybe we could do the follow-up. Is that possible, Caleb? We can get a copy?
Yes.
Excellent. Okay, so let's is that okay then if we keep it? Great.
I need to chime in here.
Oh, yes, please. Go ahead.
Okay, so this is Sheriff Tanksley. We certainly don't mind giving copies of anything that we have, but we're still in the process of providing all the information for that study. And I want to make sure that we give all the information to the consultant for the study prior to any distribution, to make sure that that person has all that information. And then once we do provide that information, like we did with the incarceration data from the jail, we'll pass that to Jill through the incarceration incarceration prevention and reduction task force. And then so they could distribute it down channel. So we're not giving certain information to certain committees, and certain committees don't get the information, if that makes sense.
Yeah, fair enough. Thank you, Jay. Okay, guys, I also just need to note that we have our next speaker also coming, so just as soon as we can, you got to follow up.
Yeah, the question about, around this is really asking for information so that because you have all of these community organizations, other folks doing similar work with the same goal, similar goal. And you have them wanting to also help inform the process of this. So if they have the same information at the same time versus later down the line, it really helps us do our job really well. So that's kind of the, it would be great for us to have it sooner rather than later. Also, we know what you're looking at, what you're not yet looking at, that we can help
supplementing your region plan, because we're all kind of working together on this. Great, so the point being that there are advantages also of being able to see the same data at the same time to enhance our collaboration, while also just the sense of the sequencing, so I hope both those. Amber, yeah.
Adam, thanks for the presentation.
Yep.
I wanted to speak to your last point when you talked about prioritizing local hires
Mhm.
for factors and subs. So a couple questions in here, unpack this just a little bit. Prevailing wage, is it going to be Davis-Bacon? Apprenticeship programs for contractors, prioritizing women and BIPOC owned subcontractors locally, and then how you may have to consider squaring all of that with the PLA that's being, the project labor agreement that's being talked about at the county council level.
Yeah, so there's no PLA for this project. It's already, like, we already have a contract draft, the RFQ is already out, so it's too late for any of that. We are looking at doing some of, achieving some of those same policy goals through the contract language. The RCW does require us, and the design builder to do outreach to the disadvantaged business community, especially those that are registered with OMWBE. If we get federal funding, then we'll have to do Davis-Bacon wages, but if we don't have federal funding, then Davis-Bacon wages don't apply. All of the work will be done under prevailing wage because it is public project. We will be verifying that, obviously. I think that answers your question. Okay, yeah, obviously we're going to encourage it. We're going to have goals for all of those things for outreach, and we're going to try to incentivize those goals through the contract. And as far as apprenticeship goals, we're going to try to go above the minimum. We're going to try to do more than just the minimum. Us at STV, and I think a lot of the folks that are going to be proposing on this project always try to go above the minimum on all those things. So
Thank you. Okay.
Yeah, and this might be a question for you, but I was just curious, are we doing focus groups on the people who are currently employed there as well? And have had to kind of deal with some of the dangers? I know, like, we've had some deaths in the current jail. Are we evaluating those deaths and seeing what safety and risk factors we could use to improve our next jail? And so I don't know if that's a question for right now, but if we're doing focus groups on the population, I think we should also be including the wide range, not just deputies, but the healthcare people who currently work there, and what we could gain from their tapping of their knowledge. Is that something you've thought about?
I would say in general that modern architectural firms that are designing these types of facilities are thinking about things in ways that they did not think about them in 1981 when the current facility was designed. If you step into one of the facilities that have been designed and built in the last 5 to 10 years, it is night and day.
And Amber, also the IRB exemption that we got to do this first round of focus groups and survey with inmates also did cover jail staff. So, if it becomes a desire of the folks working on the design to hear from staff, and we can work with that.
Anything else? Maybe one more question?
I think we need, Kayla and Adam need to leave.
Oh, yeah, okay.
Yeah.
Well, then let us, then appreciate you being here, appreciate your time. Hope to see you next time.
For the balance presentation?
What's that?
Are you gonna stay for the balance?
Yeah, I can say it. Yeah, I'm good.
And you're gonna find there where you can
Okay.
sit any place you want.
I
If
can
you don't
sit
want to
on
be in the hot seat.
Yeah.
anymore. Okay, so we get to have Julia back with us again today. She's coming in from Zoom. So then, and I see the slideshow I did see the slideshow. And Julia, so glad you're here.
Julia, just give me 1 sec to share the slides with my screen with Zoom land.
Yeah, really hoping to be there today, but unfortunately wasn't able to make it up. But glad to see so many people are able to be together.
All right, good to go. Okay, I'll control your slide. So just say next slide. All right.
Okay, on my side, and it might just be loading slowly. It's still kind of showing not the full presentation. It's from your side, it is showing.
Let's try again. I'll stop. How's it looking right now?
So I see like the intro slide, but then I see all the slides on the side.
Okay.
Can you make it full screen? Is that possible?
Yeah, let me try again.
Thank you.
Got an idea.
And then if you just go to the icon, oh, where did it go? Usually there's an icon in like the bottom. Yeah, perfect.
Are we good now?
It's still loading on my side, but
Okay.
I can talk to it, it's fine.
I'll go to the next one.
Yeah,
It's
so
looking good here.
okay. It's frozen on my side, but let's see if I can I can also pull it up just so I can be seeing it from my side. So yeah, great. Thank you everyone for the time to speak with you all again today. The slide that I believe you're looking at is just giving a recap of where we kind of left off. So if you recall, during the last time that we met in March, we talked about the outcomes that you see on the right-hand most side. And so, and then the call that I was at the month prior, we talked about the definitions of success. So this is kind of the process that we've looked at so far, going from the strategies and the projects to receiving input and feedback on the definitions of success, and then the 4 kind of key outcome measures that we discussed previously. And so if you go to the next slide.
Okay, I'm trying again because it wasn't moving on the other on what you all were seeing. So gonna try one more time here. Okay. Okay, how's that?
That looks
That's
great.
the first slide.
So we can go to the next one.
Ryan, let me just see if it'll let me go on them.
I'm trying to please everyone.
If I share, does it work if I share screen, Marty?
I got an idea. I got it. There. Okay.
Yes. Okay. So
All
this
right.
slide I was
Sorry, everybody.
No worries. That I was talking to in terms of just giving that kind of overall process. Where are we? What have we done so far? And so, yeah, during the last meeting, we talked about the outcome measures. And so I wanted to start with just kind of giving you an update on some minor changes that I have made regarding the outcome measures since the last time we talked, both reflecting kind of feedback that I received from all of you, as well as I spoke with the index committee. So if you can go to the next slide, Marnie. So one of the key values of the Justice Project is to openly and actively address inequities and discrimination. And, you know, from my lens of things, being a data person, one of the ways that we can utilize data is to identify current inequities and discrimination by disaggregating the data by different elements or kind of pieces of someone's identity. And so in the previous call, we discussed these 4 key measures specifically for the population with serious mental illness. And I got some great feedback from you all around, okay, this actually needs to be broader in terms of behavioral health and what we mean by behavioral health. So not just mental illness, but also substance use and the co-occurrence of those. And then also some great input on really wanting to look at kind of these measures disaggregated by race and ethnicity as well. And so what I've done is keep those 4 key measures the same, but instead of making them specifically just for the population with serious mental illness, kind of taking a broader definition and looking at behavioral health more holistically, as well as then incorporating the plan to disaggregate and look at these measures by race and ethnicity as well. Next slide, please. Great. So kind of another just locating us where are we at in this process. I've shared this slide before, but just to ground us, the big picture of, we came from the needs assessment, the implementation plan was made. Now we're in this developing the evaluation and performance measurement plan, which then eventually will result in a data dashboard. And this is all happening while there are the implementation of the projects is ongoing. So next slide. And so when we think about a performance measurement plan, the 3 main things that we are considering and looking at and that we have been discussing together is, that first piece around goals and outcomes. So what does success mean? Looking at the implementation plan as a whole, what do we want to see as outcomes of that? And then, this next piece, which is where we're focusing today, is more nuanced, and it's looking at the measures. So we really want to be able to get into performance metrics for each project and the definitions of success, the outcome measures, impact measures, and being able to define all of those. And then that gets into, okay, great, this is what we want to look at, but can we actually do that? Do we have the data to do that? And so that's kind of the piece that'll follow. But today we're really focusing on that second piece around the measures. So next slide. And this is a lot of information, and you all I don't know how big it is on your side, but I'm sure that font is small. So you do not need to be kind of reading everything in detail, but what this is a theory of change, or basically trying to capture in one slide the entire, the implementation plan as a whole, plus the definitions of success we discussed at the system level, service level, facility level, plus those outcome measures. And then something that Tasha has asked about a few times now is, well, what beyond those outcome measures? What's the greater impact that we're looking to achieve, which is, at the community level, really looking at increased health, increased safety. Those are the main ones. And then also in that bottom corner there, trying to capture that the communities of focus, as I was mentioning earlier, is the BIPOC community, as well as those experiencing behavioral health. And so this slide kind of captures, or attempts to capture, it all in one. And you'll see what I have at the top there.
Yeah, that's the part we can't see. So if you can read across, that will be great. Just the people in the room can't see it, just you and me.
Does it show it at all, or?
It's blocked out. How do I do that?
Do you see the gray area? Not the very, the very top.
Just read the very top columns. The top one says.
Sure, yeah.
Project.
Yep. So what you'll see going.
And it says with key stakeholders, and then we can't see anything else.
Okay. Great, thank you. So going left to right, that very first kind of column, if you will, is talking about how the Justice Project employs 5 strategies. The next column, so then it says with key stakeholders implementing 15 projects, all kind of with the aim of reaching these definitions of success and creating these outcomes. So those are kind of, that's the flow of it. But the piece I wanted to mention was the first strategy, which, you know, is where JPOP sits, is falls more into like the oversight, the process piece. And so how we look at that is different than how we look at the other 4 strategies and their corresponding projects, which are much more focused on the systems, the services, the facilities. So there's just a slight distinction there where just calling out kind of the first strategy is quite different than the other 4. And so that's why there's that distinction, if you're able to tell on your side, where that one's gray versus the others are in color. So if you go to the next slide, and these slides, you know, will be shared for those who want.
That you got that on one slide.
Yeah.
Yeah,
That's amazing.
very impressive.
Very small font, so apologies, but yes. So really today, like I was saying, we want to zoom in and look at the kind of more of the project level measures. We've been talking about the pieces that fell into the 3rd and 4th columns, if you will, in terms of the definitions of success, the outcome measures. But what we, in terms of, you know, the JPOP, haven't talked about is looking at the project specifically. So next slide. And so what I've been doing outside of the JPOP is meeting with individual kind of key stakeholders across the 15 different projects, figuring out, you know, how can we evaluate and measure the projects. And so just for kind of your information and context, the 3 main questions that I've been asking people is, you know, who is the client and or clients? What are the activities? And what does success look like? And all of that then can inform the questions of how much did we do and how well did we do it, which this is taking us back many meetings now, but those are 2 of the first 2 key questions of the results-based accountability framework. The final question, which is anyone better off? It's answered through the things that we have actually previously talked about in terms of the definitions of success and the outcome measures. But those first 2 questions are really answered through the project implementation. And so, given that the JPOP is meeting today and we have all of you together, you can go ahead to the next slide. I really wanted to dive into, you know, what does it mean for the JPOP to be successful and hear from you all. I think, you know, I have a pretty clear understanding of the client and the main activities, and, you know, we report out on that. But what does it actually mean for the JPOP to be successful, right? We're meeting, we can hold meetings and talk about the things that we're talking about, but what does success mean for the JPOP? You know, if at the end of this process, X, Y, or Z happens, you would say, yes, like the JPOP was successful. And so that's kind of what I wanted to spend majority of today talking about and getting just, dialogue, conversation, back and forth on this question and hearing your inputs so that I can, you know, then think through how we can come up with some measures and metrics for that. So really, I want to open the floor to you all. And I know I'm not there, but like, I'm more than happy for you all to kind of like talk amongst yourselves and have kind of natural, organic conversation. And somehow, you know, then Marty or Holly can filter it back to me. I'm not sure what makes the most sense, but yeah.
We we need to stay as a whole group for the sake of the members that are joining us online. But I think we can do that if people online want to talk and just raise their hands.
Things
Right.
sent to me.
What is
The
it?
things the JPOP has done already, its accomplishments. Okay.
Are you talking about for the plan, for our report?
Do you guys remember what we're doing here? Hey, what's our purpose?
Our
Performance
purpose
measures.
Yeah,
is
what are we supposed to do? Let's just start with the easy stuff.
to determine the success factors of the projects.
Determine success factors, what else?
Performance or metrics, performance metrics and measures to ensure that the 15-point implementation plan goals are being reached. How do you measure that those goals are being reached?
Whether those goals.
Updated recommendations as things evolve.
Updated recommendations as things evolve. What else? What are we gonna do?
Reduce incarceration.
Really? Actually, show
I
me.
think that's IPRTF. That's their overall, we are the metrics to show whether or not that's happening. So one of those is reduction in recidivism. Yeah.
Yeah, great.
When I think about oversight, I think about accountability.
Uh-huh.
We're the accountable, group to making sure that there is actually actions taken, systemically speaking, to reduce, regulation and so on and so forth. So
Yeah.
it would be like accountability.
Yeah, so like an accountability group to make sure things are actually happening. What else?
Can we just check real quick?
What?
Julia and Arlene
Yeah.
and Mary Lou, could you hear that? What Miriam just said? Arlene says no, Mary Lou says yes.
Mostly, yeah. I mean, I took away that the big piece is accountability, but in terms of some of the minor or more nuanced pieces of the description I missed, but
Yeah, accountable to the
There we go.
other committees to making sure that we're actually reducing incarceration and that we're also, the accountability piece goes back to the community. As Dan mentioned earlier, the community passed this because they wanted behavioral services specifically.
Yeah.
More than they wanted in jail because those other ones didn't pass. So we're the accountability people.
So for behavioral health is one part of that overall system. We're helping hold accountability on behalf of the community.
Yep.
To see that that happens. Yeah, Dave.
So I'm gonna ask Julia a clarifying question. Julia, are you really asking at this point about the specific individual projects and what constitutes completion or meeting the accountability expectations for specific projects? Is that what you're asking?
no, not quite. So thank you for asking that clarifying question. What I'm asking is, so for example, if, we said at the end of all of this, the JPOP held 12 meetings. Like, is that alone considered success? Just the fact that you all are meeting? If not, then right, what's ideally supposed to come from these meetings? It's more than just that we brought this group of people together. There is a purpose to it. And so wanting to distill what success for the JPOP and what you all are doing looks like. So it's not, success necessarily of each of the individual projects, because I'm meeting with all of those key stakeholders to get that information. But as the JPOP, beyond just meeting, like what would success look like?
Another way of thinking about it is we're sitting here a year from now. And we want to be able to say, this is what we achieved, right? So Amber.
I think one of the things that this group was founded on was that we have so many people from diverse parts of our community, right? Because we were giving a voice to different areas. So I think one of the successes that we heard those voices, right? Like we had behavioral health, we had executive council, we have public defenders, right? And so at the end of it, to be able to say like all of these were contributed in the implementation of the accountability.
Yeah, nice. So there was really a mixed stakeholder group who was part of assuring there was. Yeah.
9 years ago, I guess, when the Incarceration Prevention Reduction Task Force was formed, we asked ourselves the same question. I mean, we knew we were there to reduce incarceration, but what does it look like? What we discovered pretty early on was some of the greatest value was, as Amber mentioned, the diverse people in the room. I remember the current prosecutor having a very different perspective than a current mayor, than a current opportunity council person. but all sitting there together. And then we would hear things like, oh, even if we have the money to bring in people to do things, there are no staff. And then a light bulb would go off over with someone else. So I think one of the things you accomplish with meeting and having a forum is addressing your charge. You're bringing these voices to the table. Some of it will be planned, but some of it will be organic. Light bulbs will go off as people are talking, as long as you make a space where there's open communication and people leave here understanding more than they did when they first arrived. And that proved, I would say, the thing that surprised me most with the task force was that element. I didn't realize how siloed so many perspectives were until I watched it form. And then a couple years into it, it was like most of us knew a lot of the information because we'd been, we understood the public defender's challenges. We understood Pioneer Human Services not having employees even if we had the money. We understood Wendy coming about with what was going on with the jail and the prosecutor with their concerns and so forth. So I think that's one of the things that looks like success. You create a space where that happens organically and effectively, because it's a huge benefit.
And just to piggyback on what Jack just said, what's important is that everybody kind of moves at the same speed at the same time. Because what happens in a lot of big community outreach issues like this is one, let's say, side of the issue gets ahead of the other. And I've seen that derail things so many times. Now, if you look back on our process, I think we've been good at that. I think we've dedicated a lot of our thinking to making sure, like, for instance, the Stakeholder Advisory Committee. That was a very deliberate attempt, and I think it was successful. We spent one full year just talking about needs assessment, and we all moved at the same speed. And that's what the task force does. And that's kind of what this group can do as well, because we have that same kind of a mix that Jack talked about as far as people at the table. So I think that's another thing that's a success, is that we can arrive at whatever our conclusion point is together.
So I'm gonna push a little bit back on just the only reason this passed is because of behavioral health and that component. That isn't the only component. I think the big component is that we made a promise to the people to be accountable for the money that they were entrusting to us. And this is why I didn't pass in 15 and 17, because when we passed the original one in 2004 or 2000, whenever that was, we were supposed to build a jail and we didn't, and nobody found out where the money was. It was not clear. And so people said, we're not giving you any more money. Behavioral health was a component, but people said, we need a jail because this one's failing miserably, but we want you to be accountable and we want behavioral health. They want it all, but they want to make sure, we made a promise, we'll build you a jail. We'll build you what you need, but we want to know and ensure that the money's going there and the stuff that you're doing is working. So that's what our goal is, to show that all these things, it's not an island. None of it's going to work all by itself. We had a jail that didn't work by itself. We need these other things as well. But the big thing is people want to know that we're spending their money the way that we told them that we would spend it.
Yeah, I just want to respond to that. I don't want to make it sound like that's like the only reason that voters approved that the measure this last time. It's what I heard on doorsteps when I contacted thousands and thousands of voters was public safety was really important to them. And so it's not 2020 anymore. And by that I mean things, the pendulum is swung and we're recentered, or however you want to say it. But I do think that behavioral health is definitely a part of it. But I do think that you're right, people want folks to be held accountable. And to the question to Julia, what does success look like?
Like for this committee,
Yeah, or to the whole committee.
Yep.
Is try to reflect the will of the voters. They're the ones that are paying for it. So let's do that.
So try to reflect the will of the voters, just repeating for these folks.
Yeah, sorry.
And for people who are with us online, remember you can add in too if you want to raise your hands.
Yep. Hey, what else? What success looks like for the JPOP? So accountability, that we're all kind of coming along together, that we can express and understand different perspectives that are on the table because we have a diverse constituency here.
I just wanted to add that I remember Marianne had.
Speak up really loudly.
I remember when Marianne had made a comment in one of the meetings about how number 8 says build a new jail and behavioral health facility, but I feel like we should just get rid of jail and entirely for number 8 and just focus on building a behavioral health facility, since that is like a topic that keeps coming back up. I was speaking to an officer staff of Pierce County Jail recently, and I asked her, if you were to build a new jail, or instead of a new jail, like, would you build a behavioral health facility or just like a substance treatment facility? And they said behavioral health facility, because they are seeing inmates inside who are suffering from extreme mental illnesses, and they just don't deserve to be locked up in a cell for the rest of their life. They need actual support. So as like a youth voice, so I also get to visit like young adults in jail for my job, and the state's even talking about building a juvie, and I don't think taxpayers want to put our kids in another juvie, so we really need to focus on what incarceration is and how it can change a person's life, and how we can give them opportunities to get out of that. So yeah, I want our voices to actually be implemented instead of meeting in a room and saying all these good ideas. I want them to be used. So I value their voice.
Thank you. I'm gonna frame that in a particular way, which is we are accountable for the oversight and accountability of the Justice Project Implementation Plan, which has all those projects. We are also accountable for identifying potential changes to that plan, right? So you're saying, I might have an idea about a change, but that is another thing that we would be looking at. Are there things that we want to change? But for starters, we're responsible for how many projects, guys? 15 projects. Yeah, you're up.
Well, now I was listening to her, and so now I kind of might have spaced it a little bit where I was going with that. That happens once in a while. I was just taking it all in, so it might come back to me. But again, it's just I think of ourselves as the accountability partners to the community for the plan, and part of that is how do we measure that these things are working. So it's always back to well, I was telling in our meeting, I had the opportunity, I know several of you guys went to the National Area of Davidson County, and I had a great opportunity to sit down with the deputy chief of that project and went over the 4-year measure of success in that with his PowerPoint that he did. And so I don't know if anybody got the criteria on how they pick which people are considered for going into the behavioral health center after being arrested. There was a lot of clarification for me on that plan, having that conversation with them, and I was gonna get the criteria and just how they came up with those numbers. The numbers were great, that those that had been moved into behavioral health, there was a huge reduction in recidivism versus just those that were incarcerated. It was very encouraging, like that message. I think that having that guy come in and talk about that, you know, but it was focused on all people go into the jail first. I think that was something that people didn't understand about this, because even I didn't understand when I was working on a campaign. They always explained, or it was kind of said, well, as a cop, so that's what I do. I bring people to the jail for the charges that I have for them, and it was like, oh, instead of booking them, there's a left into the behavioral health center. Well, that's not how Nashville's set up at all, and now I understand that at a deeper level. Everybody's booked in a jail, and then from there, people like Hannah and those people trained then evaluate, okay, what's the best path here for the behavioral health or the criminal justice system, and they have a voice in that, because they get to choose as well, whether they want to be involved in that. And I think that's where we always think that we know what's best for them, but they have to engage in that belief themselves to be successful. And so we're just creating those opportunities for them. And so a long way, so I love how they were able to measure that, and I think that's what people are looking for from us as well. So, I don't know if anyone got that criteria from him, I was gonna email him and ask. Yes. So,
Yes, and that over. Well, and then I think what I'm hearing from that is also that we're kind of similar to what Barry said earlier, we're becoming more educated as a group, right? Like we are building our understanding of the issue so that we can have good, intelligent dialogue about it, right? So that we can keep that eye on the prize of, are we meeting those goals that are in our implementation plan? Okay, we need to wrap it up and transition pretty soon, but I want to see if there's people who have not had a chance to speak yet, would like to speak to the question of what does the JPOP's success look like?
Yeah, I'll speak up on that. So I'm looking here at page 2 of the meeting packet, right? So when we're talking about what are the goals of this group and how to measure it? What we're supposed to be. I mean, the list is right here, right? Like, there's what, okay. It's like, I'm not going to be honest, right? Because it seems to be laid out pretty clearly. I'm not going to read them all off, but just for example, about midway down the list, it's prepare an annual report. So I know that's a work in progress, but that'll be a measure down the line. Did we produce that report, and do the contents of that report reflect that we hit these other points? They're all laid out clearly right here. So I just want to make sure that I was reading that correctly. I mean, these are all other great ideas too for how to measure success, but I mean, at the end of the day, I think it's pretty.
Yeah, that we did the job that we were
Yeah.
assigned
Yeah.
in the resolution. Yeah, excellent.
That's actually a really nice segue to the next section of our meeting, is to look at that. If we're ready, and you also tied that up so nicely by giving us that reference back to our stated goals. Julia, how are you feeling?
No, this has been super helpful, and I'll just quickly wrap up so that we can segue in terms of, and I had another slide, but I don't want to spend time going loaded, so I'm just going to speak, which is what's next. And so just for your kind of visibility or awareness, Village Reach, so myself, will continue to refine all of the information that I've received from key stakeholders and continue to kind of put them into metrics that will build into a draft evaluation plan that'll be done at the end of April. And that's a draft, so that's going to be open for feedback and input. And then in May is when I'm really digging into data sources. And what can we measure, what can't we measure, what's our goal versus what we can do right now. So just a big picture in terms of the next steps, but I'll pass it back over to you all so that we can move on to the next agenda item.
Thank you, Julia. Thanks so much.
She listened really well. You've been picking this up. I mean, she really listened to what we said. Good job, Julia. Okay, we are now on to providing input for the IPRTF annual report. It was in your packet. Did you look at it? No. Okay, floor is open. Anything that you take issue with, that you have questions about?
I did want to just, if I can get the darn slides to
Just-
show correctly.
Just do it like that, Marty.
Okay. But I don't think that the people who are online can see it if I do it like that. So, let me just try again. Gonna do it. Okay, folks online, I'm gonna try and get you with me.
Everyone online, do you know how much Marty cares about you? She really
Do you
cares.
know what? But the slides are on, should be on the second one. I think, okay, can you all, hopefully you all can see that. Okay,
They can see the same thing that's on the screen right now. Yes.
yeah,
You just,
Yeah.
do it that way.
okay. So I did just want to say that this report, there's a big report. It's made up of 2 sections. The first section of the report is going to be an annual report of the IPRTF's activities. This is something that the IPRTF does every year. It's actually twice a year. It's required by their ordinance that form the IPRTF. Twice a year, and the reports go to the executive and to council. So we're doing that. There's that report, and then new this year, first one is a progress report about the implementation plan. This report is really going to be based on the quarterly reports that the executive's office has been sharing with us. And then we summarize those reports, and we've been putting them on the website, and you all have had a chance to review those. Another one will be coming at our next meeting from the first quarter of 2025. So I'm looking over all of those reports. There've been 3, but they've covered from November 2023, and it will go to as close to the present as we can. That's going to be this progress report on implementation plan goals. And these two are going to be, it's going to be a mashup in one big report. And what we're going to focus on today is the section that's specifically about Project 1, establishing the JPOP committee. So that was the outline that you got. And I think the main questions for you here are, did you see anything missing? Like, was anything not there that you're like, but wait, we really focused on something and I totally missed it? Or maybe you see something on here and it just seems like it's not framed correctly, or you'd like to put the emphasis in a different place. Any feedback is welcome at this point. What will happen after you give feedback today is you will see a written document before the next meeting. And at the next meeting, it will be your chance for feedback. The full IPRTF will also be getting the full report, and then they will be approving that in June. So it's a multi-step process. This is your first chance at feedback. There will be more. Okay?
So I think the one thing that we don't have on our list here that we did today was we started getting some interface with our owners rep. I think that's important because you can't believe how much better I feel having the owners rep on board. Thank you, Adam. And I think that is something that's important to mention, at least in the report, that there's now some coordination going on. We'll see how it all rolls out as time goes along, but I think it's going to be great. And I'm very optimistic.
So add that in.
I think it's under 5, right? Planning for people engagement. Would that be STD?
I think we can get
It's a little bigger than that.
more explicit. Yeah.
I see something small, Marty. Under number 2, my understanding is this committee elected a chair and a vice chair, and they're participating with steering committee and integrating into the task force as a whole. And I think that should be noted.
Yeah, it's actually co-chairs and a protege is
Okay,
what we have.
great.
And yes, thank you.
Yeah.
Anything else?
The protege rules and assignment, you said it for something else.
Oh, proxy.
Oh, proxy. Oh, okay. Is that in all like the charters?
That's it. Yep. Any other thoughts about this?
Let's keep going then. It is.
Thank you so much. That was helpful. All right. So the last things we have are just a couple of announcements, and then we'll move to public comment. I sent out an email yesterday after we got new proposed dates for the tour of the Didwalish Wellness Center. And all of you are invited to take a tour of that center. The dates are April 29th and 30th. It will be a trip to Anacortes. Dan Hamill offered this. and just trying to help organize it, and we'll need to carpool. So please let me know if you, thank you to those of you who already let me know. And please, if you want to do that on the 29th or 30th, let me know which date or dates you can do, and if you can drive, or if you need a ride, okay? Also, we'll see you there.
What, is it like afternoon, morning?
Yes, it's meeting at around 1 at City Hall to get in cars. And then tour is 2 to 3:30 in Anacortes, and then come back.
Both days are going. But
No,
if you
if
want-
everybody, yeah, if we have, yeah, if everybody who wants to go can do a particular day, we'll do it once.
Do you have one that people are leading into more than not?
Not at this point.
What was the forum with this stuff?
If we had a quorum, we would need to divvy up into 2 groups. Thanks for that reminder. So yeah, if everybody in the committee wanted to go, we'd have to use 2 dates. So do say in your response, which dates you can do, okay? For that reason also. Thanks. All right. The next announcement is that we had a brief talk at the last meeting about a summer recess being in July or August. We chose July. All right. So no JPOP committee meeting in July. And our next meeting, these are the topics we're going to cover. It's like I already said, reviewing the progress report that we're going to get from the executive's office, providing input on the website, and that'll be just like in, how that report and how things are looking on the website. We expect to continue discussion with Julia on the performance measurement plan, and you will have received the draft IPRTF annual report, and so we'll gather your feedback. And now it's time for public comment. Let me just pause. Does anybody have any questions about any of that?
Remember when you had mentioned, like, we had that meeting and you explained what JPOP is to me? And you mentioned that nobody that actually like does the work in the Whatcom County Health Department is actually like a member of this committee. Is that so true?
That is true, but thankfully we have Hannah, and Dean was here, and every meeting has had somebody from the health department here, and we are so grateful for that. Yep.
So, yeah, public comment.
So anybody here who's not an official member, this is your time, and anybody online who's not an official member who would like to say something, let us know. Are any of you who have joined us online, who are members, did you want to say something that you've kind of been sitting on? Okay.
Good. So I want to just thank everybody who came to present. Thank you. Adam, right? Yeah, okay. Thank you to Adam from SEB. I want to especially give a shout out to our co-chairs because they have been we meet before the meeting, we figured everything out, and they're also showing up at the IPRTF stuff, so they. Yes.
I zoomed in from Vegas.
That was above and beyond, Tasha. That is dedication.
And I'm so glad Taylor, thanks for yeah, it's so awesome to have you here. So everybody, it was lovely to be together. Make sure to grab a little snack and something to drink before you leave. I'm gonna go ahead and close this out on time. Actually, I think you get to.
Yep.
Did you get to say the official thing?
Oh, I am officially closing the JPOP meeting that was held on April 17, 2025. It is 3:56 and the meeting is closed.
Yeah. All right. Good job.